One Mentor here with Medins Tutors. So today's session is all about the orientation of MRCOG Part 1 exam. In today's session, we will discuss exactly what is MRCOG Part 1 exam, what are the benefits of getting this exam done, and how you can book the exam, and how this exam looks like, what is the exam pattern, what is the timetable, and how you can book the exam successfully. So these are the agendas of today's session. But before proceeding further, I just want to know, like, how many of you are attending this MRCOG session for the very first time? Please do let me know who just joined us today for the first time.
Me.
Okay, so I think most of you are newcomers. So I wanted to ask another question, which is important so that I can take along you with myself. Like, please do let me know what is your target timeline for sitting in the MRCG Part 1 exam. Are you planning to sit in the July attempt or in January 2026 attempt?
Yes, July.
That's perfect. Okay, so we have July candidates with us today. That's perfect. Okay, so let's begin. Okay, why MRCOG and what MRCOG stands for? Basically, it is a membership exam of Royal College of Obs and Gynae of UK. So basically, it is a specialization exam which consists of three parts, which is part 1, part 2, and part 3. And once you have cleared all these parts, you will get your GMC registration and you can easily apply for jobs in the UK, or you can practice in your own country with a very good specialization degree. So it definitely, if you have MRCOG exam cleared, you will have this golden membership, and this would definitely add the credibility in your status or in your CV. So the first and the foremost benefit of passing MRCOG 1 exam is that you can practice in the UK. You earn high credibility in most of the countries because it is recognized in globally. You can work at senior level in all countries. So basically, it's an exceptional exam with exceptional achievement. So if you have this membership, definitely you will become exceptional practitioner. Everything you should be understand about the MRCG part 1 exam. You should be clear about the exam structure, like what type of questions are going to be there in the exam, and what are the scoring, and how those questions are divided. Then you should be able to know what is the exam calendar, when is the right time to apply for the exam, what is the exam fee, what is eligibility, what is the booking process, and the most thing which is very which creates panic among the students is the study material and how they can start their study. So again, MRCG Part 1 exam has three parts. Part 1, which is basically theory-based exam. MRCG Part 2 is again theory-based exam, and MRCG Part 3 is the OSCE exam. The difference between Part 1 and Part 2 is that in Part 1, we mostly focus on the basic subjects like anatomy, physiology, endocrinology, all the basic subjects you have already studied in your medical school. But in MRCG Part 2 exam, mostly the curriculum involves the guidelines regarding obs and gynae practice. And 3 is the combination of different things which it assess different parameters of a health practitioner, which is needed to work in a safe healthcare practice. So exam structure. This exam consists of two papers. One is paper 1 and other is paper 2, and each consists of 100 SBAs. So what is SBA? Please do let me know in the chat box, do you have the understanding of SBA questions? Okay, Dr. Amna, you said multiple choice question. Well, you are right in some way, but basically it is single best answer question. Yes, it do comes with multiple options, and you need to pick one answer. But the difference between simple MCQ questions and single best answer question is that in single best answer, the options, maybe two or three options might be correct. So you need to choose single best answer according to the question statement. So this is the tricky part in this exam. So you will get 100 SPA in paper 1 and 100 SPA in paper 2. The time for paper 1 is 150 minutes, roughly 2.5 hours, and same goes with paper B. And in between paper 1 and paper 2, you will get 1 hour break. Am I clear to everyone? Okay, for now, the first thing you need to do is your eligibility. What is eligibility? Basically, it is a request to RCOG that you want to sit in the exam. So what you're gonna do, you will go on the website. You need to click on the eligibility section, enter the required details like your full name, your registration ID number, your all the details they are asking about, like your home country, your graduation year, your ethnicity. So everything would be there. You just need to fill that form and attach your registered medical license or maybe your medical degree along with your ID card copy. Uh, you need to take a picture of your passport or your ID card. You just need to attach one out of those. Maybe you can pick your passport or maybe your ID card. So only two things are required: your medical degree or your medical license. So you need to pick one, and your ID card or your passport, and again you need to pick one. So two things you need to attach on your eligibility form and just submit that to RCOG. So this is your eligibility. Once you submit your eligibility, you need to wait for 4 to 6 weeks. So I would advise you to do this step as soon as possible because sometimes it might take 2 months. And if you don't get your eligibility done by the RCOG, you are not able to appear in the exam and you are not eligible to book the exam as well. Is everyone clear about the eligibility? So this is the first step and there is no fee for the eligibility. Okay, so all of you, you need to send your eligibility today. Okay, do this step as soon as possible so that if by any chance, if there is any error occurs, if there any rejection came from the RCOG, you still have plenty of time before the closing date. So that's why it's crucial to apply for the eligibility as soon as possible. Okay, so once your eligibility is done, your second step would be submission of expression of interest. Again, for that, you need to visit RCG website and everything is pretty straightforward. You just need, if you scroll your screen, you will see below the eligibility section, there would be the section of expression of interest. What is expression of interest? It is the expression you will show to the RCG that you are interested in sitting the July attempt. So that's again very simple. You just need to enter your email ID or the details you have already used in making the RCOG account. And this is just a 1 minute process. So this would be your second step in your booking process. The third step would be once you receive the confirmation email of eligibility from the RCOG, you will get an email on when the windows open for the exam booking. And on that very day, you will book your exam and pay your fee. So that would be your last step in the booking process. However, don't feel overwhelmed by all these steps. One step at a time. Today, your task is to submit your eligibility. Okay, so what are the subjects we need to cover in MRCG Part 1 exam? I have told earlier that we need to focus only on the basic subjects. And one good thing is that apart from all of these basic subjects, we just only focusing on the topics which are relevant for the OBS and gynae practice. Am I clear? For instance, let me elaborate this a bit more. If we are doing anatomy, so what do you think, what regions you need to cover if you are sitting in obs and gynae specialty exam? Any idea? Okay, for anatomy, if we are studying anatomy and we are writing for obs and gynae exam, so we need to focus on the anatomy of abdomen, pelvis, and perineum. Yes, perfect. So that is the anatomy which is included in your RCOG curriculum for MRCOG Part 1 exam. So don't worry, that's a good thing, by the way. There is no need to cover entire neuroanatomy, thorax, upper limb, or lower limb. So that's a good thing. Biochemistry, again, it would be focused. We just focused more on those topics which are relevant for the obs and gynae practice. Physiology, again, physiology, mostly they cover the maternal physiological adaptation during pregnancy. And yes, some fetal physiology topics are there. Endocrinology, it is very, very important for this exam because it covers uh, literally entire obs and gynae. Then microbiology, pharmacology, again, pharmacology, it is very precise, very easy module. Why? Because we are only going to do those drugs and medicines which are used in the obs and gynae clinical practice. So it is very straightforward subject. Then biophysics, pathology, we are only focusing on the pathology of the female genital tract. Genetics, immunology, embryology, we need to cover everything. Clinical management, data interpretation, and statistics. Okay, apart from these modules, the clinical management is the module in which you need to touch some guidelines, but not in very much details, like because the guidelines are for MRCG Part 2 exam. However, for Part 1 exam, you just need to know, have some basic idea, like how you're going to manage. You should know the guidelines, how to manage the CTG interpretation, how you can interpret that, and how you, according to the guidelines, you're going to manage your patient. So this is some, there are some basic guidelines you need to cover. Some other ones are hyperemesis gravidarum, endometrial hyperplasia, cervical neoplasia. So these guidelines are there, you need to cover. Okay, so the important thing. Okay, please do let me know, is everyone clear about the booking process? Or do I need to repeat anything?
Yes, ma'am, clear.
Okay, that's perfect. Okay, since we are clear about how we are going to book the exam, and now we know what are the modules we need to cover. Now the next question is, what study material do I need to start from? So the recommended books for, in terms of your theory, is Oxford Revision Note, Essential Revision Guide. These two books are the theory books. Then for the SPA practice, and I want to let you know that in this exam, the most important thing which helps to pass, help you to pass this exam in first go is your SPA practice. The more you practice SPS, the more are the chances for you to pass the exam in first go. So for the SPA practice, there are plenty of books in the market. However, I have shortlisted these one, and your size are 550 SPS by Catherine, SBS by Ankush, and Get Through SBS. So, and yes, Pass MRCOG. This is another book which is not written there, but you can also take Pass MRCOG, which comes in two volumes, volume 1 for paper 1 and volume 2 for paper 2. So that is a nice book to follow. Okay, so our recommendation is for theory again, Oxford Revision Note or Essential Revision Guide. 550 SBS by Catherine, exam type questions, which are classically your recalls. You need to cover at least last 5 years recalls for this exam so that you have a better idea what type of questions comes in your exam, what is the mindset of the examiner, and how you can build your reflexes on those. and pass MRCOG. I think this study material is more than enough to ace this exam. And one tip here I want to add, don't mess around with the study material. Don't follow multiple platforms, don't follow multiple books, because at the end you will not able to revise everything, and and most of the books in the market are not updated yet, so that would lead to unnecessary confusion. So, to avoid this double-mindedness, confusion, and waste of time, try to be very focused in your exam preparation, because at the end of the day, this exam is all about the smart strategy. If you study in the right way, in the smart way, you will definitely pass the exam. So again, I'm repeating the books. For the theory, you need to cover, maybe it's your choice. If you want to follow Oxford, that's good. If you want to follow exam essential revision guide, that's good. These two books are for theory. Then for SBA practice, I would recommend to start from 550 SBS by Catherine, because it would help you to cover the theory topics as well, and at the same time, it would help to practice the SBS. Then exam type questions, which are your recalls, they are the must. You are not supposed to write the exam without doing these exam type questions, and pass MRCOG. It's a good start. Okay, so it's again, it is a review of exam booking process. First of all, you need to go on the RCOG website, make an account. This is a very simple procedure. You all must be familiar with how you can log in on any social media platform. So this is a simple process. Then submit your eligibility, expression of interest. And once you are done with that, and once the booking window opens, they will send you the link or the email for the booking of the exam. And once you get that email, just you need to just book the exam as soon as possible and pay the fee on that day. Okay, so now let's discuss how we can start the preparation. Now we know the exam structure, that we have 200 SBAs, 100 in paper 1 and 100 in paper 2. And now we know that the SBAs are single best answer questions. Now, and also we know that what are the books we should have in our hand to start our preparation, but how we can organize our study material. That's the uh, that's the important step. So in order to study in a strategic way or in a smart way, we need to organize our study material. So what you are gonna do? First thing, focus on the high yield topics from all the subjects, because uh, let's imagine you are studying physiology and you open up Guyton, which is a very lengthy and extensive book. Do you think that are you able to retain all that information from the Guyton? Probably not. So that's why you need to be very focused. I always believe in good in quality but less in quantity. By that means, focus on the high yield topics more, have a good grip on those topics, because mostly the questions comes from the high yield topics, so that you will feel more confident and you have already done your 60 to 70% of your exam. And if rest of the things, by any chance, if you don't remember on the exam day, that would not disturb your passing ratio. Okay, now you know what topics you need to cover. You need to focus on the high yield topics. Now, how you can start study on the daily basis. So one thing which has to motivate you is the daily mini schedule. That means you are assigned by a daily task that these are the particular topics you need to cover on this particular day. So this will help you to daily motivate. This would help to motivate you to study in everyday basis. You may also join the live sessions with me to clarify concepts for each subject. Practice daily SBS. This is again, I'm repeating. SBA practice is the key to pass this exam. So what would I recommend? For instance, if you have started anatomy and you are studying anatomy of the interior abdominal wall. Meanwhile, you need to open up your SBA book and solve the SBAs from the interior abdominal wall. So this is how you can take along your SBAs with your theory. And this is the perfect way to ace the exam. So where you can, what are the other platforms you can discuss SBAs is our Telegram study group, in which you will discuss SBAs according to the mini schedule in the with the mentor. practice subject specific exam like questions on the website. On our website we have separate pools. We have segregated all the past recalls into each module. For instance, if you are studying anatomy, so after the end of the module, or while studying the module with a mentor or daily telegram group discussion, meanwhile you can go on the website and solve the anatomy SPS from the recalls. And once you're done with everything, you're done with the live session, you're done with the Telegram daily discussion, you're done with the SPA subject like exam like questions on the website. At the end of that particular module, you will get a subject-wise mock exam. For example, in this case, if we are starting from anatomy, so after we are done with anatomy, we will have a big mock on the anatomy. Get evaluated by the mentor for each subject to build a strong foundation from the beginning. So this would help to focus on your weak areas. Okay, so this is for our premium students. What they're gonna have after their access, they will have full website access. WhatsApp, they would be added into WhatsApp study group, Telegram study group. They would be provided with the course schedule and the daily mini schedule. And what are the things which are available on the website are the main schedule and the mini schedule, live session link, live session recordings, books, subject-wise mocks, subject-wise recalls, PDF of the lectures, and the big mock exam. So all of these things are included in the package. Okay, so I want to know how many of you are doing full-time job, or how many of you are not doing any job at all? Okay, so for those who are not doing any job, okay, I wanted to give a rough idea, like how much time you should at least have in your pocket to pass this exam. Okay, for those who are not doing any job, uh, 3 to 4 months are enough for them. But in these 3 to 4 months, you need to study 6 hours on everyday basis. And for those who are doing full-time job, I would recommend you to start studying immediately. Try to save at least 2 hours on everyday basis, and you should have roughly 5 months till your exam. Because I understand the people who are doing full-time job, I know there are some days when you are not able to manage even a 1 minute for your studies. So that's why for all of you who are doing job, please start studying immediately by tomorrow. Don't waste your time. Okay, so those who are doing job, how do you plan to balance your study schedule with clinical duties? Do you have any idea in your mind like how you're going to manage this? Okay, Dr. Ike, don't worry. Basically, what I want to emphasize here, we totally understand the doctors have very busy schedule, and since we have a fixed time for the live sessions, we have fixed time for the Telegram group, and I understand I have seen so many students who do not manage on those particular time period. So for those, this is a beneficial thing. We have added these recordings on the website. Like whenever you have time, while maybe when you are driving, you can start the video, you can listen the lectures. Maybe when you are sitting in your clinic and you have some free time, you can watch the live session at that time, and you may solve the SPS from the website. So the purpose of the website is to facilitate your exam preparation in a handy way. So this would be helpful. And for those who just don't want to listen the recordings, they will provide it with the PDFs of the lectures. So they just have a read for those lectures. So this is how you can utilize the website. Okay, so one thing. Now we are done with the most of the things which which are important for the orientation of MRCOG Part 1 exam. So here on the screen, you can see the MRCOG 1 curriculum, which is there on the RCOG website. This is a summary of that curriculum, and they have made some knowledge areas, and they are going to assess you in your exam on these bases. So what is the knowledge area 1? It is all about the clinical skills. That means there would be some questions which are assessing your clinical skills. Teaching and research, core surgical skills, then post-op care, antenatal care, maternal medicine. In maternal medicine, you will cover your pharmacology, management of labor, management of delivery, postpartum problems, gynecological problems, which is mainly your pathology module. Then subfertility, sexual and reproductive health, early pregnancy care, gynecological oncology, urogynecology, and pelvic floor problems. So these are your modules. Okay, I have highlighted only the anatomy ones. This is how we can pick the topics. So here in the knowledge area 4, if you can see here in the post-op care, they have mentioned histopathology of pelvic organ, breast, endocrine organ, including the pituitary and the hypothalamus. In the antenatal care, they have highlighted the maternal anatomical, endocrine, physiological adaptations occurring in pregnancy. They have mentioned about the fetal anatomy. In the management of delivery, they have mentioned about the female perineum and principles underlying the management of perineal repair. In knowledge area 10, they have mentioned about female reproductive tract, anatomy of female reproductive tract, including an understanding of changes at puberty and at menopause. So this is the purpose why I have shared the RCOG curriculum, because many students, they think that they are missing out on so many topics. For example, the most repeated question I have got from the students is that they are worried about leaving behind anatomy of upper limb, lower limb, thorax, and neuroanatomy. So the purpose of highlighting these knowledge areas is that they have clearly mentioned about the to the point precise anatomy they are going to assess you in the exam. So this is for your reassurance, and this is how we have made all of our curriculum. And if you open up your Oxford Revision Notes or Essential Revision Guide, you will see that they are also following the same curriculum. Okay, so I'm going to give you a demo lecture on anatomy. I have taken a topic which is femoral triangle. Okay, by doing this topic, I will show you how you're going to read the theory, what important points are needed to be highlighted, what are the points, like how you can pick up the high yield points. So this would give you an idea. So femoral triangle. What is femoral triangle? Basically, if you can see here in this diagram, this is the wedge-shaped area, which is formed by the depression between the muscles of the thigh. It is located on the medial aspect of proximal thigh. It is the region of the passage of the main blood vessels between the pelvis and the lower limb, as well as large nerve supplying the thigh. And here in this picture, you can see again, here is the femoral triangle, which is a triangular depression between the muscles of the thigh in the proximal medial aspect of the proximal thigh. So this is the anatomical location for your orientation of femoral triangle. So what are the important things you need to cover from femoral triangle is the boundaries. The borders of the femoral triangle can be remembered using the word sail. Okay, I will show you the diagram and then everything would make more sense to you. For now, just trust the journey and just have a look on the borders. Okay, we set a mnemonic SAIL, S-A-I-L. S stands for sartorius muscle. So basically the femoral triangle have a lateral border, a medial border, base or superior border, floor, roof, and apex. So these are the boundaries of femoral triangle. The lateral border is formed by the sartorius muscle. Medial border is formed by the adductor longus muscle. Base is formed, or superior border is formed by the inguinal ligament. Floor is formed by the APPI mnemonic, which is adductor longus, pectineus, psoas major, and iliacus muscle. The roof is formed by the fascia lata, superficial fascia, and skin. Apex of the triangle is pointed towards the adductor canal. So this is a simplified diagram. Again, we are talking about the boundaries. Okay, on the superior border, we can see the inguinal ligament. On the medial side, we can see adductor longus muscle, and on the medial side, we can see the sartorius muscle. So these are the major three boundaries you need to remember. Please drop in the chat box regarding the boundaries of the femoral triangle. Please tell me what structure is making medial border of the femoral triangle. Yes, it's adductor magnus. Okay, one more thing. Adductor longus muscle. It's not adductor magnus, it is adductor longus. One thing I want to add here regarding maybe you will get a simple question, simple in this way that they directly ask you the lateral border. Yes, that is formed by sartorius muscle. Medial border, yes, it is formed by the adductor longus. But to be more precise, maybe they will ask you what type of border of that particular muscle is forming the lateral border. So the answer is sartorius. Yes, it is making a lateral border, but if we look at here, the medial border of the sartorius muscle is making lateral boundary of the femoral triangle. So it's a tricky thing, but if you look at the diagram, you will get to the point. Yes, this is the lateral boundary of the femoral triangle, which is made up by sartorius. But if you see here, this is the triangle, and the medial border of the sartorius muscle is making exactly the boundary of the femoral triangle. Is everyone clear about this point?
Yes, ma'am.
Okay, and for adductor longus, it is simple. Adductor longus, yes, it is making medial border, and the medial border of the adductor longus is making medial border of the femoral triangle. So that is simple. Okay, so now we are done with the boundaries. The next thing, the question you need to know after the boundaries is that what are the contents of a moral triangle? So anyone have any idea, any content that comes to your mind?
Please repeat the question.
Okay, my question is, what are the contents of a moral triangle?
Femoral vessels.
Femoral
Yes,
vein, artery,
excellent.
nerve, and I guess internal lymph nodes.
Okay. Well, we have femoral vessel is the correct answer. We have femoral artery, we have femoral vein, and we have femoral nerve. The usual mnemonic we used for the contents of femoral triangle is navel. And it follows, please make sure we are following the lateral to medial aspect. So if we go from the lateral to medial aspect in the femoral triangle and we look at the alignment of the content, we will see the mnemonic navel. First of all, we will have femoral nerve, artery, vein, then femoral canal, and at the end we have lymphatics. In your exam, what they usually do, they just twist around the question. They will ask you, please pick one of the following the contents of femoral triangle from medial to lateral. In that case, you need to reverse the order. Did you get my point?
Yes.
Yes, ma'am.
Okay, please write in the chat box the contents of femoral triangle from medial to lateral direction. Okay, so this is the better demonstration of the contents. Okay, so we are going from the lateral to medial side. So most laterally we have femoral nerve. I'm talking about lateral to medial direction. First of all, we will recall the mnemonic navel. We have femoral nerve, femoral
No.
artery, femoral vein, femoral ring, femoral canal, and we have lymph nodes here. Okay, followed by the contents of femoral triangle. Another important thing is, what is femoral canal? Anybody who have idea regarding the femoral canal? Okay, so let me tell you, this is the extension of this topic. In the femoral triangle, as you can see here, this is the femoral triangle. The contents, excluding the femoral nerve, are enclosed in a wrapping of fascia called the femoral sheath. The sheath is funnel shaped and best described as a sleeve of fascia extending towards the apex of femoral triangle. Where it fuses with the adventitia vessel, it continues spirally with transversalis fascia, iliac fascia of the abdomen. Okay, so here you can see uh, the contents of femoral triangle, but if you look at closely, you will see that this is the femoral sheath, which is enclosing the femoral vessels. But one question here is that your SBA, that which of the following content is not there in the femoral sheath? So please look at the diagram and answer my question. Which of the following content of the femoral triangle is not enclosed in the femoral sheath?
Femoral nerve.
The nerve.
Yes. Yes, exactly. That's correct. Excellent. So it is very obvious that femoral nerve is not enclosed by the femoral sheath. So now you have two types of question. Although it seems like it's a very simple topic and the questions are very simple and the answers are very straightforward, but they just twist around the simple information. So maybe they will ask you the contents of femoral triangle, or maybe the question from the contents of femoral sheath. So now the difference between the contents of femoral triangle and femoral sheath, you need to exclude femoral nerve. Okay, so each of the structures located in the femoral sheath is individually closed in its own compartment. The most medial compartment is known as the femoral canal, which contains lymphatic vessels. The proximal opening of the femoral canal is known as the femoral vein. So this is a demonstration. Now we are now we are in the femoral sheath. We are done with the contents of femoral triangle, but now we are just classically focusing on the femoral sheath. Here, this one, uh, uh, the diagram which I'm going to show you is the cross section of this area, this femoral sheath. Okay, what they have said that this femoral sheath, the contents are individually further, they are present in the compartments. They are not just, they are not there as it is, they have their own compartments. As you can see here, in the first compartment, which is the lateral compartment of the femoral sheath, is the femoral artery, along with the genital femoral nerve, the femoral branch of genitofemoral nerve. Then intermediate compartment, we have femoral vein, and in the medial compartment, we have lymph nodes of Cloquet or Rosenmuller lymph nodes. So these are the contents of femoral sheath. Okay, how you can make SBS out of this topic, that maybe they will ask you what content is there in the lateral compartment of the femoral sheath. Please answer me. What is the content of a lateral compartment of femoral sheath? And there is a nerve as well.
Femoral artery with femoral branch of genitofemoral nerve.
Yes, excellent. So that means the femoral nerve, yes, it is not the part of femoral sheath, but yes, there is a nerve in the femoral sheath, which is femoral branch of genitofemoral nerve. Is everyone clear about that?
Yes, ma'am.
Okay, again, this is a summary femoral canal. What is femoral canal? It is the smallest anatomical compartment located the most medial part of femoral sheath. The opening of the femoral canal is located superiorly, known as a femoral ring. The femoral ring is closed by connective tissue layer with the femoral septum. The septum is pierced by lymphatic vessels exiting the canal. Flocate node is a lymph node situated in the femoral canal. So basically, simply this is the most medial part of the femoral sheath is known as femoral canal, and the opening of this femoral canal is known as femoral ring. That's it. Okay, let me summarize the topic. Now you can see from the beginning, there were a lot of theory lines which are just there for the one read, but they are not supposed to for the memory purpose. So this is a complete topic. Maybe you are going through from a theory book and you will see a lot of theory in the textbook. But the point I want to emphasize here is that you need to pick out the high yield points which are relevant for your exam. For instance, in this case, I didn't ask you question from all of the theory points. I just pick out the high yield points that you need to know the lateral border, medial border, or superior border. That's it. What is another high yield point here? This was an exceptional point, that sartorius muscle, which border is there, which is forming the lateral border of femoral triangle. So this was an exceptional point. So we just quickly remember just these three highlight points, high yield points, and rest we can skip the theory. Then I just simply ask you what are the contents. There's no need to go through from all the theory. You will find your textbooks, they have such theory, but you just need to pick out the highlighted points. Femoral nerve, okay, in the derivation of femoral nerve, what you need to, what you should be knowing that the root value of femoral nerve. Okay, in terms of anatomy, it is important whenever you are studying any, this is a tip for your study and for your anatomy. Whatever the artery you are studying, whatever your nerve you are studying, you need to know their origin. For instance, why I have mentioned the root value, because this is how you can retain anatomy. Otherwise, it is very, very volatile. For instance, you have studied today about femoral nerve. Now you should want to know that what is the root value of femoral nerve. So please remember the root value for femoral nerve is L2, L3, and L4. That's it. These 2 points are the high yield or the take home points from this topic. Then the femoral artery, your question should be, your next question should be, femoral artery, from where it comes from? Like, this is a very normal and logical question. So it is a branch of external iliac artery. So now you are going to study the branches and the arteries, the root values at the same time. Then, yes, now you have the orientation of the diagram, because anatomy is all about the visual study. Then yes, there were a lot of theory, but I didn't focus on that. But from this topic, we just need to know what are the contents of femoral sheath, and what is not there in the femoral sheath, and what is its lateral most compartment called, which is femoral canal. And the opening of the femoral canal is femoral ring. That's it. This is all about the femoral triangle. Is everyone clear? Is everyone clear how you're going to study anatomy and how you're going to carry along with your textbooks? So this was an idea, like how you can pick only the high yield points, how you can make questions from the simple information, and how you can think about the other alternatives of that question. and how you can left behind the irrelevant information. Yes, you can have a good read, but there's no need to memorize those lines because this exam is not essay writing exam. So only thing that matters in the exam is your concepts and your good memory. And for you will with time, I bet on this, after studying anatomy and even before the exam day, you will say that I'm not able to remember the arteries and the nerve innervations and the root values and the lymphatic drainage. I can bet on this. So that's why I'm giving you the tip. Whenever, wherever you will see any artery, any nerve, please trace that artery and nerve uh, at that at that very moment. For instance, now we have discussed about femoral artery. Now you should be knowing what is the from where it comes from. It comes from the external iliac artery. It is a branch of external iliac artery. Then we have studied about femoral nerve. So please tell me what is the root value of femoral nerve?
L2, L3, and L4.
Perfect. Excellent. So this is how you can study anatomy in a smarter way. So let's assess your knowledge, what you have learned so far. This is your question. You have 40 seconds to answer this question. The femoral triangle is bounded medially by which of the following structure? Perfect. Adductor longus is the right answer. Okay, here are some tips and tricks to solve SPAs. First of all, always, whenever you encounter any SPA, try to understand that question. And most of the time, the last line of that question is very important because sometimes the scenario they have given, maybe that is a distractor. And in the last line, they will ask the particular information they are expecting from you to answer. So that's why don't rush while reading the question statement. Then there is a method of elimination in which if you are not sure about the correct answer, start eliminating the incorrect answers. So at the end, maybe you will reach to your right answer, or maybe you are left with the two options to choose between. Don't rush. You have plenty of time in this exam. There are so many good things about MRCG Part 1 exam. And the one thing is that the time is enough for this exam. So there is no need to rush. You have plenty of time. Then clinical reasoning. Think about clinical implications of each option. So try to relate that question, especially this tip is very helpful when it comes to the questions of clinical management. So you can correlate your clinical practice with the question solving. Then the last one is the practice is the ultimate key to pass the exam. The more you practice SPs, the more are the chances for you to pass the exam. Okay, for any technical support, you may contact on our WhatsApp or Facebook page, or you may email us. And here's the good news. We are offering our MRCG Part 1 premium course in just rupees $225, which is valid till 31st of January. Any questions? Okay, here I have mentioned the course fee is $225 till 31st of January.
Ma'am, can you discuss about the recalls? How do you help us doing the recalls? Do you solve it for us, or we have to do it and then we'll match the answers, or how do you do it?
Okay, that's a wonderful question. Well, definitely, we are going to help you with the recalls because that is the key for the exam, and they are very crucial. So, what I have already told you, we have the recalls in three different formats. The first format is the questions, the subject-wise pool, which are solved, and once you solve that on the website, they will show you the correct answer with the explanation. If you are still not able to understand that particular SBA, you can simply straight away ask to the mentor. You can share the SBA your any query, the mentor would be there to support you. The second thing is once you're done with the module wise system, then at the end you can solve the subject wise recalls from the last 5 years on the website as well, and they are solved. Once you solve the SBAs, they will show you the correct answer, the explanation why your answer is wrong and why the other answer is correct. So everything would be there. The third format is the PDF form, which is also uploaded on the website. So if you don't want to solve the SBAs by your own on the website, you can straight away go to the PDF and start studying and solving the SBAs there. However, they are also marked. Am I clear?
Yes, ma'am.
And in that way, you will, if you notice, you are going to revise the recalls 3 times. One, when you are solving the subject wise, second, when you are solving on the website pool, and third, on the PDF. And at the same time, you are practicing these SBAs and the recalls in the Telegram group as well on the daily basis. So this is how you can 3 to 4 times revise all the modules, and it will definitely ensure your high success rate.
Ma'am, another
Uh,
question.
yes.
Ma'am, that is, there are a lot of groups offering this MRCG one course.
Hmm.
A lot of groups. I wanted you to share why should I pick your course? Just just to understand why should I choose you as my mentor? I know this about this. There are many instructors. They are really good, but there are so many other. It's quite messy when I start deciding which way to go or whom to choose. It's quite
Okay.
confusing. So, can you please help on that?
Yeah, your worries make sense to me, and that's a very valid question to ask about. Well, yes, I know there are various platforms, and everyone is just trying to be in the competition. Well, why I recommend our course is that we have a systematic approach to ace all the curriculums or the modules of the MRCG Part 1. We have successfully segregated all the recalls in the subject-wise manner. We have created three different formats of recall pool, and also we have the live sessions. We have the most systematic and organized way to cover all the modules from the MRCG Part 1 curriculum. If I recall everything, by the beginning of your session, we offer a live session in which we will discuss in detail about the high yield topics. And once you are clear your concepts on the theory, then you will get a PDF of that lecture as well, which is not available in any other place. I'm sure that. And what is the benefit of that PDF and the live lectures? That would reduce that would save a lot of your time. You will save your time for your SBA practice, and there is no need to spend too much time on the theory books like Oxford or Essential Revision Guide. Our previous students, we have 100% passing ratio in the previous batch, and they all followed the just our live sessions and the PDFs which are provided by the live lectures. So that would be more than enough to pass the exam. And they are very precise notes, and you can quickly cover all the high yield points which are relevant for your exam. However, if you are going to study any theory book, there is a lot of information you cannot retain for your exam. Am I making sense to you?
Yes, ma'am. Ma'am, does those PDFs or notes cost extra money, or it's all included in this 225 rupees?
It is included in the in your package.
Thank you, ma'am.
So that is something which is exceptional. Then the other thing I would love to talk about is that daily SPA practice, because that would, since I have told you that this exam is all about the practice, the more you practice, the more you familiarize yourself with the basic concepts and questions, the more are the chances for you to pass the exam. And definitely, if you are studying, let's imagine if you are going through from the basic concepts during the live lecture, you have cleared your concepts, then you have a read on the PDF, then you solve the SPS on the daily basis, then you are solving the anatomy, for example, anatomy recalls on the website, then you have a mock exam, and then you have the year-wise recall. I think if you follow this technique, there is no way you can fail the exam. So it is pretty reassuring. Yes, Dr. Kashif, this is the updated curriculum. Okay, so do we have any other question?